Hello, everyone. Welcome again to the second episode of our podcast. For those of you familiar with me, and for those of you who aren't, my name is Jason. I am the host, quote unquote, of this show here. I have three wonderful guests with me today. If you all would like to take a moment and introduce yourselves to our audience.
Hi, I'm Zach DeYoung. I'm a family medicine physician at Upper Great Lakes Family Health Center, located at the SDC at Michigan Tech.
I'm Whitney Boroski. I'm the manager of student health and wellness at Michigan Tech.
I'm Corey Miller. I am a graduate student in the kinesiology department at Michigan Tech, and I work in the wellness department with Whitney.
Our episode today is focused a little bit more on speaking with a professional in this field, Dr. DeYoung. He has some insight for us and a little bit of an opinion from what he's seen, what he's worked with as far as the COVID-19 situation has gone. And he's here to offer some advice, offer some reassurance, and give us exactly what we're looking for. So, Dr. DeYoung, I guess before we get started with any official quote-unquote stuff, what's been happening? What's been going on? What has life been like for you as of late?
It's been very interesting over the last few weeks. I got back from a conference the first week of March, and this stuff was rubber was starting to hit the road at that point. So we had a conversation about how we were going to get to work to address this for our patients, and started looking to the CDC and the health department for some help about that. And it's been a nonstop roller coaster every day since then. So it's, there's literally been a new guideline out from the CDC or the health department every day since then. And my job is to kind of keep up with that, get that information out to the other providers and our nurses and also to our patients, and then navigate those treacherous waters as we go. So, it's been interesting every step of the way. It's been a lot less patient interaction for me since this came out, because we're trying not to see patients in the office a lot of times unless it's essential or life-sustaining care. Otherwise, a lot of that's been done over the phone or the computer. And now we're actually doing the drive-through testing here out of the back door, you might say, the side door of the Gates Tennis Center. And that's been interesting too. So today's our third day of doing that, and it's going pretty well. Just a challenge to get that up and running so fast. But so it's something different every day, I said, but probably actually more accurately to say every half hour something changes.
Yeah, with things so rapidly changing, every 30 minutes you can get a new piece of information. You have to do a 180.
Yeah, all the students left, and it's been really boring. So and the sports stopped, the students left, and so we had to think of something to keep busy. So we came up with this.
Corey, what's your life been like? What's your role been in sort of this whole debacle and everything that's been happening with you?
Well, since classes switched to online, it wasn't like too much of a hard transition for me. I've always been a commuter student since I started at Michigan Tech. I was born and raised here from Calumet. And I kind of hate to say that due to this pandemic, I was able to accept a part-time position at a local nursing home, Portage Point, to be specific. So I started working back there, and it's kind of nice to be able to at least do my part, be able to use my license before it was about to expire in June, and get more of those patient care experience, actually do something, be able to go to a job, have something stable. I like stable things, and I like to keep busy. I like to do stuff, and I'm just really excited. I'm excited to help out and see kind of where this goes.
Doing as much as you can with as what you're given, so to speak.
Yeah.
Especially trying not to go stir crazy at this point in time. I can understand that.
Oh, gosh, yes. I try to at least get a walk in every day, too, or like a run, because I also need to be outside. Like, I can't just stay in my house. I am doing safe social distancing, so if I see somebody on, like, the running path, I'll get off as much as I can, but just all doing our best.
All right, let's take a minute here and let's talk a little bit about the COVID-19 directly. So specifically in regards to COVID-19, I think there's been a lot of information since it's first come out, and there's still a lot of information being dispersed today. But as a professional, what can you sort of tell us is going on as far as people's options to seeing doctors if they need care, or if they should be going to the doctors if they have symptoms? What do those symptoms look like? What sort of stuff are you seeing?
Yeah, it's a big change. So because the risk to the healthcare professional and the folks working in the office is substantial. On the recommendation from the CDC and the health departments are switching to telemedicine and telehealth resources for visits for a lot of things that can be done that way. So if there's something that you need to see your healthcare provider about that's possibly done over the phone or through an audio-visual two-way communication, then we try to do it that way. So if you are a student who's been coming to the SDC for your care, you may have spoken with your provider over the phone or over this app called Helo, which ties into our chart recently, and that's how we're doing a lot of our business right now. It took a little bit of getting used to from the providers and I think some of the patients, but we got to find a way to have access to our patients when we don't have access to our patients, and that's how we've done it. So, onesie twosies here and there as people have something that just absolutely cannot be done over the phone or over the app, then they're able to come into the office for those things. But I don't know if anybody's come in for any visits, but you are greeted at the door by a screener who asks you a series of questions about your current health, and they may take your temperature. And if you have any of those symptoms that are suspicious for COVID, then you're taken directly to a room. You skip the check-in desk in the waiting room so that you're basically in isolation, actually in the clinic. So, a lot of that personal interaction stuff that is why I got into medicine. A lot of that stuff's kind of, it's not the primary concern right now, unfortunately. We try to do that as best we can over the phone and the computer, but it's not the same as being in the room with a patient,
Right.
So that's been a big adjustment for us.
I was going to say, how effective do you think the virtual appointments and the telecommunications have been?
Well, I think it's getting us by. There's not going to be a replacement for the physical exam.
Of course.
When you're seeing your patient. And just, again, being able to look someone in the eye in the room and, the handshake, that's gone. We're not doing those in there right now. So, those kinds of things, we kind of miss those, and we'll see if and when they come back. But I actually think the genie is out of the bottle a little bit with some of these telephone and virtual visit resources. I don't think we'll be able to do away with those now because actually I think a lot of people really like that. So for some things it may be appropriate, but everyone's going to have to come in from time to time so the doctor can lay some hands on you. And if there's a test that needs to be done, obviously we can't do that through the phone. So those things are still going to be around, but there's been a lot of adaptation to those other resources lately.
Corey, what's it been like at the nursing home that you are working at currently? How has policy and sort of interaction changed there as a result of the COVID-19 situation?
Well, currently we're not allowing any visitors. They're thinking about even kind of restricting any sort of outside people coming in, like even from the hospital. Like say if someone who works in the hospital knows an elder kind of around, like maybe even trying to limit that a little bit more, trying to make it more of a closed system. Lots of mask wearing. I just got more training on PPE, so personal protective equipment, for specific patients if they have COVID or any other sort of diseases, illnesses. Just a lot of mask wearing, honestly. I've only been working back there like on the floor with the patients. Last night was my third shift back, so still just kind of getting the feel of things, how the management's handling it. I think everyone's doing the best that we can, and given the certain situation, you kind of just got to roll with the punches and learn to be flexible. And that's the one thing I learned from studying abroad the past 2 years is just being flexible, and we'll make do and we'll get through this.
That has been the name of the game, so to speak, for it seems like quite a while now.
Corey, I really applaud you for jumping in there. I mean, you had some training and some skills that you could use right now when we needed you here in the area. So
yeah,
make it straight. You and if there's any other students out there that are jumping in where they're at.
I was originally going to take a float position because I wanted to go back, and because with thinking about physician assistant schools, because of course I have to wait until next cycle with everything that's been kind of going on. Getting more patient care hours is great, and they had a float, so I would go in like once a weekend every month. But then, online classes now, I can take the part-time position, and it kind of works out too, where I can make it work fall and spring semester. So I'm very happy to be back and doing my part to help in the situation, because there was a huge need. I know at Portage Point when I was first applying, I think they had like 7 openings, so there was a need.
So both of you mentioned, obviously, with in your respective fields with the telecommunications and virtual appointments, and then restricting visitor access in the nursing home. The whole concept of social distancing, is it working, Dr. DeYoung? From your experience and from what you've seen so far, can you say that the social distancing we've been practicing up to this point has helped to mitigate the effects of what we've been fighting so far?
Well, you have to use the projections from earlier on in the pandemic to kind of answer that question. And so there were some pretty dire projections. If some of the ones, and again, a lot of these models, these projections they're based on certain assumptions and using some pretty fuzzy numbers that there's a wide range on those. But
right.
The one that's real popular, the healthdata.org one, IHME, from I think it's the University of Washington, that was making some pretty dire predictions early on, and we are far below what that says we might have been getting ourselves into. And that's wonderful. And I've been a little discouraged by the numbers that the state is reporting lately for the new cases and deaths. Was hoping that we would have peaked around the 8th or 9th of April and that we'd be well into the downswing by now, but we are flat. So we're not doubling every 3 days, which is what was happening early in the pandemic, especially at like places like New York or other places where it caught on like wildfire and just went nuts. So that's reassuring to see that we're flatter. At least the number of cases and deaths for the most part has been steady for the last week and a half, and maybe trending down. Now today's an exception. They had some reportings issues, and today's deaths are a lot higher, actually the highest they've been the entire time. That's just due to how they report things, but for the most part things are going down. So why? Well, if the virus can't jump from person to person, that's probably the issue. And so I think as much as we don't like being away from other people, I mean, I really would like to go to KBC right now and hang out with people I know there, or my kids, there's certain things they wanted to do sports wise right now that we're not able to do. We really miss all that, and it's terrible. Those are memories we'll never get back, but I'd like to get through it with my family to be able to make new memories. So yeah, it's I think it's important. I think we're going to look back on this and say we did better than we might have if we hadn't done this.
That is the hope, certainly. How is it looking right now in the Houghton area specifically?
Well, so right now in Houghton County, we only have 2 positive tests. So not counting the tests we've done here at the drive-through testing site we've set up, there's been about 180 tests so far done in the county. And so again, only 2 have been positive. So I think in the Western UP, we have the benefit of being inherently socially distanced, which is to our benefit. So that may be to our benefit early on. The epidemiologists I'm talking to at the health department, though, are worried that what we're going to see is a later spike for us, because Detroit, Southeast Michigan, with the denser population, the socioeconomic issues there, the healthcare disparities there, they're going to see an earlier spike and a later, and they'll drop off before things start to get bad here. So that's what we're worried about. So that's really the impetus behind us doing the drive-through testing, is trying to get as many tests as we can to see where we really are at.
Right.
Give the epidemiologists the numbers they need to really make those calls about, is Houghton County, is the Keweenaw, the Western UP in general, able to look at relaxing social distancing and stay-at-home orders and those kinds of things, or do we need to hang in there with these for a little while longer, even though we only have had 2 confirmed cases so far here in Houghton County.
Right.
So.
Yeah, certainly moving forward, regardless of whether the orders are relaxed or enforced again for a longer duration. One of the points that I think is consistent between any of the sort of directions we take is using proper protection and making sure we wash our hands, sterilize surfaces, everything like that, in order to try to mitigate everything that's going on and as far as the spread of this virus. And so actually, I wanted to touch on a point here. Corey, I believe you were the one who brought up the point about fabric masks. And I wonder if you could sort of elaborate a little bit about your experience with that and what you had to say on that.
Yeah, one of my roommates, her grandma actually made us all fabric masks here for me and my 2 other roommates. And I guess I didn't really know what the policies were yet at Portage Point, what they had. And like, I heard that there was a shortage of supplies. So of course, like I brought my fabric mask just in case, rather be safe than sorry and at least have something. So finding out too, like we do have enough masks. Thank goodness the ones normally used, not fabric ones. So I guess, and then I just hear a lot of mixed things on social media, the internet, just about what like can be used, what can't be used. Like I guess, I don't know, are fabric masks like an okay like substitution for, so like the general public, not healthcare, non-healthcare providers? Like what's kind of the happy medium there, I guess, was kind of my question. Because there's a lot of, I guess hoarding going around too of even like the N95s. And I guess I'm just kind of curious, there's mixed literature right now, a lot of mixed literature. And there was even some of my coworkers were telling me too how they read that COVID-19 sticks in your hair and so you got to wash your hair more because, you might spread it that way. And I don't know what is.
Well, hopefully we can at least prevent lice from spreading. That'd be a plus.
Yeah,
but,
that's true.
Dr. DeYoung, any insight on fabric masks and what Corey's mentioned?
Yes. Okay. So how about I go a little bit bigger and I talk about masks just in general? Yeah. Okay.
Yeah, that'd be great.
All right. So N95 masks are the ones we're normally going to use for airborne and droplet precautions. Like if I've got a patient with tuberculosis, I certainly want to be wearing an N95 mask when I'm around that patient. So the recommendation is for folks who are going in wearing personal protective equipment, the full complement of that armor against the virus, but that N95 is part of that. So the procedure mask that I'm wearing right now is not considered adequate for those sorts of interactions. Early on, when I didn't have as many N95 masks as I wanted, I had to make do with what I had. So I had to go in the room with my sick patients wearing this procedure mask like I'm wearing now because it was the best that I had. So now that I've got the N95s, I certainly wear those every time I see anybody that I'm worried may have COVID-19. So procedure masks are okay. They're not really the standard. Cloth masks are not considered PPE. The cloth mask recommendation is really for hopefully reducing transmission from me to you, not from you to me. If I'm wearing a cloth mask and you're coughing and sneezing around me, that cloth mask probably is of questionable benefit to me. But if I'm going around shedding virus as I breathe, walking through the grocery store, wearing the cloth mask may be of benefit to everybody else who goes by and picks up a watermelon that I was breathing near. Okay, so that's the idea with those. So I don't know if the science really backs up the cloth masks. There's a lot of debate on that, but I'll tell you what, if I see people wearing cloth masks in the grocery store or wherever else I'm going when I'm out and about outside my office, that it's a sign to me that person is taking these recommendations seriously. And if we approach each other on the running trail, that person's going to take a few extra steps to the left and I'll take a couple to the right, so we avoid each other. And that's just kind of like it's kind of like a visual handshake to me. Like, hey, I got this, you got this. Okay, I respect you, you respect me. That's what it really is. It's about those common courtesies, I think is what it is, especially in this time. So to me, it's an outward sign of taking it seriously. And I encourage everyone, even if it ends up being bunk, wear your cloth mask. Really, it's just a show of support for the whole thing. So, but in regards to PPE, no, a cloth mask is not sufficient PPE. And when I'm out there doing my swabs for the testing, I'm absolutely wearing an N95 face shield, a bouffant to cover my hair. I don't have much left, but I do want to keep it off what hair I do have or my bald skull here. Okay, I've got a cool surgical gown I wear and gloves on, and there's a procedure for putting that on and taking it off the right way that I follow. And now I'm wearing this procedure mask right now when I'm talking to you all because I'm not alone in the office. There's somebody, she's, what do you say, Christy, you're 16 feet away? 16 feet away. But, it's just a courtesy to her for me to wear my mask. So
a perfect segue actually into our next point we were going to mention, the severity of the situation and sort of people who are taking it seriously and who aren't taking it seriously. And Whitney, you may have some insight into this as well, if you want to offer any of your expertise on this. But what sort of suggestions can you offer? Because not everyone is taking the situation maybe as seriously as they could or as they should. And it can be difficult to have a conversation with people who, well, first off, with people who don't see the world as you see it, but also with people who in this tense time disagree with you about the way things should be done or the precautions that should be taken. How do we manage to have conversations with those people to ensure that we still are practicing those safe preventative measures, and we can hopefully try to mitigate the effects of everything that's going on?
I think it's really important in this time, to just try to be really transparent with one another, whether that's family members, roommates, healthcare providers, people that you work with. I think it's really helpful to be transparent with how you're feeling, and that can go either way, right? How I'm feeling if Corey on me or vice versa. Um, and just really try to be transparent with your feelings and what your anxieties are. I had somebody ask me the other day about their roommates, and that their roommates may or may not be taking this COVID-19 pandemic as seriously as what they were. And I think that can be talked about on more of a like national scale, right? There's some people that aren't taking this seriously, and there are lots that are. So the advice that I gave to that student was, go to your roommate and have this conversation with them, but really just come to that situation and say, like, hey, I am having a really hard time because you're doing this, and I just want to keep our home safe, right? So really just be transparent and like vulnerable in that situation. I keep telling people, we just really need to find ways to be real with each other, especially these times that we're going through. Just really having these conversations like, hey, I don't like that you're doing this, and it's kind of freaking me out, and you're not staying 6 feet apart, and you keep going to the store when you don't have to. Like, you can say these things because that's just how it is right now, and we can be worried about odd things, and but I think you also have to be prepared for them to say that back to you, right? So if you're watching them, they got to be watching you. So I think that can go both ways, but I would definitely recommend having the conversation and just being real and transparent. And you can say, hey, this thing is freaking me out, and we might run out of toilet paper. I think the toilet paper jokes are making everybody last through this thing. But yeah, I would just be really real with the conversation and don't let it stew. And just, if you need help, try to look at reputable sources. Again, we keep talking about the CDC, State of Michigan, Michigan.gov, the WHO, just making sure that we're very mindful of what our experts are saying and what our professionals are saying.
So I think a lot of times the facts just don't do it for people when there's a disagreement like this. So you have to make an appeal to the person's identity as a decent human being. So I guess I'd approach it the same way as somebody who's leaving a mess in the bathroom. You know, hey, you got to clean up after yourself in the bathroom. You can't leave that there. Make sure it's gone, because, you know, it's just out of respect for everybody else here in our environment, sharing the bathroom together. So, you know, you don't want them to feel like they're a slob. You want them to feel like there's somebody who cares. So the same kind of approach, I think, works for a lot of people. If we talk about, hey, this is just out of common decency for everybody else around you. It's for my grandma. You know, you're not doing this for me. I'm not going to die if I get sick with this. But my grandma, she's 90, and if she got sick with this, that'd be terrible. So I'm asking you to please, you know, take this seriously so that my grandma doesn't get sick with this. And I think that's the kind of approach that works for a lot of people.
So, Dr. DeYoung, are there ways that if you still have people that live around you that aren't taking this seriously, are there ways that you can protect yourselves in addition to masks? Is there a way that you can take some steps just to protect yourself? Maybe if you live in an apartment or live in a house with somebody, your own space, are there steps that one can take to protect themselves?
So if you lived in the same domicile with someone who wasn't taking this seriously, that's going to be pretty challenging, because like if we had a patient who had confirmed COVID or suspected COVID-19, we would tell the other folks in the house to actually give that person their own bathroom, their own bedroom, and not share anything with them. We talk about a special way to clean the area where the sick person was. And, you know, there's limited things you can do, but that's the kind of conversation we'd have with them. So if you're in a domicile, an apartment or rental house, whatever, with somebody who's really kind of wandering around, coughing and sneezing on things and touching them, that's going to be hard, because you can't just confine. They're probably not voluntarily going to stay in their bedroom or use one bathroom the whole time. So, Yeah, that's tough. I mean, you might be better off getting out of there if you have the option. I remember being a college student, and that was not an option for me necessarily. So that's tough. Yeah, you can't really wear gloves around your own house and have that really meaningfully help you in any way. You can't go around with a can of Lysol and spray everything in a meaningful way and have that work. So I don't know if I have a good answer for you on that one when you're sharing the domicile with a disrespectful person. That's tough. Now, I know a lot of students recently, the ones that were in the dorms, took advantage of the buyout, so to speak, and I hear they went, back to their other homes with their parents if they have that option. I think actually, Whitney, you and I were talking recently about what to do about the students who have rental properties, and if they already went back down to Illinois or Wisconsin or wherever, what are they going to do when their lease is up, about coming back to get their couch and those kinds of things. So those student living considerations are they're considerable, aren't they? When you're not like a permanent resident of that location, perhaps, and sharing it with multiple other people of various outlooks on life. So I don't have a good answer for that. I don't. It's a complicated situation. If it was easy, we wouldn't need the CDC for that, I guess, right?
Right. So maybe it's just reiterating having that conversation.
Yeah, for sure. For sure. Yeah. And yeah, pick better roommates next time.
I mean, I kind of feel like people's true colors come out during times like this sometimes.
Right. Yeah,
how to pick a roommate, COVID-19 version.
If it was like me, now in the house I shared with my buddies, we had like a chore chart, and I was the bathroom guy. I don't know how I got stuck with that one, but I sure wouldn't want that job right now.
That sounds like a crappy deal for you.
Yeah, it was. Yeah, right.
Right. So as we, I guess as we wind down here we're coming to pretty much to the close here. I want to ask each of you, I guess, eventually we will get to the end of this pandemic, and we will be able to go back to our normal lives, whatever those look like. It may be a short time in the future, maybe a long time in the future. We're not sure yet. But when we go back to our normal lives, what is the first thing that you're looking forward to doing in your semi-regular normal life when you can go back to doing it?
Going to a restaurant. That's a big deal. I mean, we do takeout. We're trying to support the local businesses right now, but I don't know, just being able to sit down and BS with a waitress and see, Houghton it's a big, small town, and I've only been here for 7 months, but I know 2/3 of the people here already. So that's always nice to get to know people and see people I know when I go out, and just, I mean, that's a little thing. That's a little thing.
Of course.
Yeah.
Yeah, I guess I'm excited just to get out again. We like going out to eat, and we have a lot of family in the area, none of which we're visiting. So we're pretty social people. And while I like being home and I like being stuck in my home sometimes, I've never stayed inside this long. So it'll be nice to see other people and friends and family. And summer is coming. That is very exciting. I want to go boating and camping and hiking and do all the outside things. You don't have to be worried about being too close to people.
Yeah, definitely for me, it's seeing my family. And then with going back to long-term care, I'm not seeing my family right now because my grandparents are definitely in the high-risk population for this right now. So can't wait to go see them, go out on our 40 acres of land, put my hammock up, read Game of Thrones, still, book 2. Also take a long drive down to Florida to go see my boyfriend. So little things.
Jason, what are you going to do?
It's a complicated situation for me because I enjoy sort of being inside and, doing all the like sort of computer stuff and everything like that. But being in this situation has made me miss sort of like the daily get outside and go do something, other than just sit around. And so it's weird. It feels weird to say, but I've gotten bored sort of what I've grown accustomed to. And I'm aching just to like go outside and go for a hike or something like that. I just miss being around something that's not these 4 white concrete walls that surround me, like almost 24 hours a day. But yeah, I think that's pretty much what we got for this episode. So thank you all for joining me. Any last minute words of advice, encouragement, care, anything like that?
I can't wait to see the students back. I can't wait to see you guys back. I miss you so much.
I honestly miss being on campus. I miss being able to print for free. I mean, I have my printer here and I used the printer for like 2 years. The ink is still full and it still works.
Wow.
I'm winning.
That's very impressive.
I know the faculty and staff miss you as well. I think I hear every day on my gazillion Zoom meetings. I miss the students, or I just miss seeing them, or I just miss bumping into them. We all miss you guys.
Excited to be back. Hopefully get back to a more normal lifestyle in the near future. Other than that, I'd like to thank you all for listening for today's episode. Make sure you stay safe, wash your hands, and spread joy, not sickness. Take care.